Good morning, and thank you for joining us for day 2 of the NMQF Leadership Summit. My name is Congresswoman Robin Kelly, and I'm proud to represent the 2nd Congressional District of Illinois. I also serve as the chair of the Congressional Caucus, Black Caucus Health Braintrust, and I sit on the Health Subcommittee of Energy and Commerce. First, I'd like to thank my dear friend, Dr. Gary Puckrin, and the NFQF staff for their hard work in coordinating this year's summit virtually. This year, we have faced severe challenges. COVID is definitely the one that is top of mind, and yet they keep on doing their work. So thank you so very much. COVID-19 is not a disease of the poor or the rich. It affects everyone from our head of state to the people who serve food at our favorite restaurants. However, it has definitely shown a light on the disturbing health disparities that face people of color in the United States. The numbers may be shocking, but not surprising. We know these disparities have long existed. We knew about them long before COVID-19, and we should have acted sooner to prevent so many unnecessary illnesses and deaths. Thankfully, right now, we have the best and brightest in America and across the world working to find a cure and treatments for this disease. We have heard from some of them and will hear from others today. Some will be recognized with our 40 Under 40 awards. While my focus has been on addressing disparities, we need to hold the line on progress we've already made. Everyone should be able to afford healthcare and treatment because healthcare is a human right. But repeated attacks on the ACA are making this a difficult task. From the ACA lawsuit that is slated to come before the Supreme Court to the nomination of a new justice just weeks before our election, who does not seem to support the ACA. Our health and our healthcare access is literally on the line before the Supreme Court. The ACA hasn't just presented coverage options for millions, it has created new opportunities to close the gaps created by racism, a plague which has been declared a public health emergency by a number of medical associations, cities, and counties. Lack of coverage and equitable care directly causes increased rates of maternal mortality, early death, and suicide in too many American communities. But the news is not all bad. Recently, I was able to get a line included in an appropriations bill that would increase the funding for the CDC to study gun violence as a public health issue, something long needed. We have also expanded opportunities for people to be able to see their doctors without having to leave their homes through telehealth. We have finally brought the attention to minority communities that they deserve, and we hope to keep the drumbeat going. Many of these recommendations were included in my Kelly report, which we will be discussing. I am glad to be at the forefront of bringing us closer to achieving health equity, and I hope to continue working with brilliant minds across the country on Capitol Hill and through the NMQF to ensure that all Americans will have their voices heard and have a chance at a happy, healthier, and longer life. Thank you, and I look forward to the rest of our panel today.